So I grew up here in Sioux Falls. I moved to Mitchell, South Dakota when I was in high school. So I graduated high school from there and then went down to University of Nebraska in Lincoln for undergraduate, then moved back to Vermilion to live and go to medical school at USD, and then moved to Sioux Falls to do my psychiatry residency and then child and adolescent fellowship. I never thought I would go into psychiatry. I did a psychology major in undergrad, but I did not think I would continue to practice that. It wasn't until medical school when I got to interact with patients and understood how much the social background really impacted their treatment in psychiatry that I really felt drawn to that specialty. A huge part of what I focus on is the relationship between parents and child. That relationship depends a lot on how the kid can interact with them and how the parents can interact with the child. The big part of my job is trying to educate as much as I can on things that are normal and don't need treatment, and things that maybe are out of normal spectrum and do need, to be worked on. I've had many patients who come in who've had lots of behavioral issues and struggled in school, and we are able to stabilize them, and they're able to go to school, succeed, pass classes, and start living their life instead of being in trouble all the time. So typically the first time I meet a patient, it's really for them to feel comfortable in my office and get to know them and their backgrounds, where they came from, and their experiences in life really help me understand how to best treat them going forward. And so it's really working with them and developing a relationship and teamwork to understand where we go from there. My favorite thing is just getting to form that relationship with my patients, knowing who they are when they walk through my door, forming that connection with them. It's really fun when kids come back and they tell me about how they scored their first home run in a baseball game, and I get to be somebody that they get to share that excitement with. I really enjoy that part of my job. All of my training has been here at Avera, and it's given me a really good outlook on how they support the community by supporting mental health with their inpatient and outpatient resources. There is some mental health stigma, and so it's really awesome to see a large healthcare system that finds value in it and really wants to make a difference in the behavioral health community. I love to travel. I love going new places, experiencing new things. I like to see new cultures and just put myself out there in the world. And then I also really love to read.